Hi everyone, my name is Chelsea Okundolor, and today my drug infomercial is going to be on opioids. So firstly, we're going to be talking about what are opioids. They are a class of drugs used to reduce pain that is known for being highly addictive. We're going to be talking about the different types of opioids. Prescription opioids can only be prescribed by doctors and is used to treat moderate to severe pain. Common types include oxycodone, hydrocodone, morphine, and methadone. Heroin is an illegal and highly addictive opioid made from morphine. And fentanyl is a synthetic opioid pain reliever, which is much more potent than other opioids. It is typically used for cancer pain or other severe pain. So I'm going to be briefly talking about how opioids work. Opioids attach to the receptors in the nerve cells of the brain, and once they attach, they send signals to the brain which block pain, slow breathing, and has a general calming and antidepressing effect. Many people describe this as a euphoric effect. This image to the right, you can see a nerve cell. On the top, you can see a normal nerve cell, and on the bottom, you can see a nerve cell 20 seconds after it's been activated by morphine. And this image was retrieved from the National Institutes of Health in 2020. So first, we're going to talk about methods of usage. One methods of usage for opioids are oral, so you can take it as pills or capsules by mouth, intravenously, so injecting directly into the veins, inhalation, inhaling by smoking the opioids, usually with a pipe of some sort, and intramuscular, which is injecting directly into the muscles. Secondly, we're going to be talking about opioid addiction. Now we're going to be talking about the risk of opioid usage. The first is dependence, which are the physical feelings of withdrawal when not using. Addiction, which is a chronic disease of the brain that causes an individual to compulsively seek out drugs, even with the adverse outcomes they may have experienced. Withdrawal, which is the physical and mental symptoms caused by cessation of opioids, symptoms including anxiety, fatigue, vomiting, sweating, depression, seizures, and abdominal pain. Some other risks and consequences of opioid misuse, as we said, dependence and addiction, disease contraction from intravenous drug use. So many people can contract different diseases by not using clean needles or by sharing needles with others who possibly have other diseases such as HIV. And it can lead to changes to the physiology of the brain, overdose, and death. Now we're going to briefly go over some numbers related to opioid deaths. So 50,000 accidental deaths caused by overdose occurred in 2015. Of those deaths, 20,000 of them were caused by prescription painkiller overdose. And of those deaths, 12,000 of those, 12,900 to be exact, were related to heroin. Next, we're going to be talking about the opioid epidemic, the opioid crisis in the United States. So how did the opioid epidemic start? In the late 1990s, pharmaceutical companies such as Purdue Pharma's reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. Subsequently, this led to widespread diversion and misuse of these medications, before it became clear that these medications could be indeed highly addictive. So the issue with this is that Purdue Pharma marketed their drug to medical professionals and the entire medical community as being unlikely to cause addiction because they used an extended release capsule cover over the drug so that people would experience the pain relief over an extended period of time. That way they would not, it would supposedly be very hard to abuse a drug because it would just release over time. There's no way of just getting it all at once. But what we found was that people were able to easily remove this time extended release cover and take all the drug and experience the euphoric effects that they're looking for, and sometimes that they were not exactly looking for. And the Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including costs of healthcare, lost productivity, addiction treatment, and criminal justice involvement. Okay, now we're briefly going to go over this chart that I got from the CDC. From 1999 to 2018, almost 450,000 people died from an overdose involving any opioid, including prescription and illicit opioids. This rise of opioid overdose deaths can be outlined in 3 distinct waves that you can see here on this chart. So the first wave began in the 1990s with an increased prescribing of opioids. Here to about here, you can see that especially the commonly prescribed opioids purple line is really high during this period. The second wave began in 2010 with rapid increases in overdose deaths involving heroin. So we see this orange line, and we see around 2010 that there is a large spike, and it's steadily rising in 2010 and up, of heroin usage and deaths caused by heroin. This probably has to do with the fact that doctors were realizing how bad prescription opioids were contributing to the opioid epidemic. And then when people could not get opioids as easy anymore, they switched over to heroin. Or the third wave began in 2013 with the significant increases in overdose deaths involving synthetic opioids, particularly those involving illicitly manufactured fentanyl. You can see that the black line right here just shoots up in 2013, much higher than both commonly prescribed opioids and heroin. And it's seemingly still rising. And here are my references that I use for this presentation. All my references here. I'll also be linking them down below. Thank you guys so much for watching this video. I hope you learned a lot about opioids and opioid addiction, as well as the opioid crisis in the United States. And bye.